Send the link in my mouse. Yeah.
Okay. I'll just post it again on my WhatsApp.
Ebusiafo yamakwa aba eba the Gawa Hour tumedi ne so within the Tina Sapon, the host of the Gawa Hour. Enumere se waba so a na wa share na wa invite obi e de amame na wa ye di dwumadi no ahyehyɛ so ene me ne yen sister Anna na ebetwetwe nkomo e wo the Gawa Hour dwumadi ne so timonyemre na momra na yemedi apomudin ho nkomo na mebisa se apomudin ho nsem etesei apomudin ho nsem etesei mpamocha mun share program na mun invite mame mun share na mun invite yebedi apomudin ho nkomo ansa na no me kwakoje aboafo nkrato abasese ya de djumadi no ahyehye so na me fa kwanya we so ama Mr. Frederick Addison a happy birthday Mr. Addison yankopon shira no fa mfie bebre nka wo mfie homa na oma de da wakoma so nyina no embremu emma nti mpamocha mon share na yenko aha share the program. Yo, ebusiafo. Me pamacho you streaming live nso ewo YouTube. You streaming live ewo YouTube until say oba so na wa share program no e de amame pamacho bebre mo share my na and topic I be kan ho asem no so it's very very important. There be a topic no very important until no said the yen na watch bia no yesi wapomuden ho nsem ete say mun share na mun invite mun frɛ unua no bi so frɛ no nuamra na fa dwumadie no enhyehyɛ so the Gawa Hour dwumadie no so na mwasugu so a mutie muso mfutina sapon mene Miss Anna Esiama ano na ebetwetwe nkomo eni nti mun share na mun tag oba so nso anu abolive no so de amame bolive no so na yenko yanim bolive no so yo for share the program, please share and let's go. Please share the program and let's get the ball rolling. Na me twa me ho akwaje aboafo nkrato abasema na de dwumadie no ahyehye so. Dwumadie omo asoya sen our Cares organic skin mixture. Akese si bibiara a ehaw ewo widie mu fa bedan wo mo na omo beboa ama widie no atoso kama enkodu summer time no na widie no shrine to say ahyehye emema no so mekanfo oji shades e de amamo se mu se de oji skin no ayete toso yero na ni secret na maka no our Cares organic skin mixture oji shades for our Cares na kwaje wo de e wo 917-836-3155 917-836-3155 afen so mekanfo Myla Homes e de amount se upe baby adwojo wo ho upe baby ni abusua anase adofo atena say long term anase short term Myla Homes e na ubetimi di wani akere ukwa abo promo code edinkra u discount e yebochu ma from Myla Homes e wo +233 530306462 from Myla Homes na ombe ma baby adwojo wo ho eho ewo East Legon na afen so a very serene environment bibiara a ope amenities bia ope bia Myla Homes ewo ma say bambo ho nsem na say security pools and say Wi-Fi internet access any problem ewo Myla Homes nti frɛ wo mo na enu amundi ensa wo so afi EcoBank Ghana Limited EcoBank is say CD accounts na opese obi and say dollar accounts opese wo to ejapade and say uhia loan a frɛ omo say your bills na pese wutua frɛ EcoBank Ghana Limited na omo ne obedi ensa wo so frɛ EcoBank +233 260-714-3006 for EcoBank Ghana Limited na eni omo ntwetwe nkomo se wo ye event na ope obi ama no anoa aduane ama wa de meka mfa ama wa KK Ruby Cuisine KK Ruby say a year na wo ye say outdoor na wo ye event bi a wo ye bi an from no mbe no wonu ane no ama omobo no so de eda form bete eno ane say obefrɛ wo mo ewo 646-530-6126 Frekeke Ruby Cuisine na omonwa wonu ane ma so ye event na pe obi amana siesie ho no ma wa mekanfo Questi events e de amount so ye decorations kama event bi a wo ye say ye say outdoor say baby shower wo frɛ wo mo e was 646-841-6420 ombeje wo fɛ so no wasiesi event no so ase ama kama so ye upe obi nso ama na ye drinks local drinks bi ama wa mekan for Lodan drinks e de amount say ginger drinks, pineapple drinks, and as so bolo na ope drinks be a ope be a offer or more ewo 347-740-6093 wo drinks be a ope be a no on be yama ebusia for me makwa ba eba the Gawa Hour jumedi ni so midin di tina sapon the host of the Gawa Hour mpabocho mo share program na yemko na MC OG me who say so OG share program no Miss Doris upon so it was for mom right na twetwe apomuden ho kombo me say apomuden ho nsem ete say and they colon cancer ho asem na ye ba beka ehu hia yie ne senti ye ne yen sister ana esiama ano a oye nurse practitioner New York Columbia campus and a between come and what question be a ultimate to comment session na say na your video comments no at the amount I feel so no e ka cry baby phone lines na they atune ti obi person ofre na obi sa asem a e kwan eda honom nti no enche pi me the sister Anna ebeto line so sister Anna me ma kwa baba de Gawa Hour jumedi ne so
yeah nua o me da se when invite me na me ne oba betwetwen komo
Mbacho, impomo to say.
Impomo ya nyame adom bibia boko.
Yo, ene medical abo wabodin no. Say oh your family nurse practitioner na yesa.
Patrai.
Aye, okay. Inti no say ye kase colon cancer e ho asem e decide any colon cancer na say dey na colon cancer ever.
Okay, before I start in person me date you for nyina say ye dama system mutie yen bibia obi anyame nhiraw. Your colon cancer is mostly your colorectal cancer because usually they happen together. It happen with colon more, your friend colon cancer, happen with rectal more, and now two are your friend rectal cancer. But sometimes it might happen with both of them near friend colorectal cancer. Before me can about colon cancer no, I was saying who say colon wo baby or your brony beka say your digestive system. It's the largest part of your digestive system. And now udidi absorbing nutrients and you and also it means store the albedino. It means store it as a waste. Or rectum so a store waste no, but at the same time no, it means a spelly waste no. In the form sesebi ukuja onasia no a rectum rectal. What causes colon cancer? Before mekano cancer yeah anything with like abnormal growth into genes no and as our cells no that means say a grow we be abnormally. Colorectal cancer happens when there's like a change in genetic material. It can also be caused by mutations. You can mutations you can say maybe our cells no and shut down for me. It being so it happens unknown and then you friend unknown cause and I say in the medical term idiopathic causes. Colon cancer also can happen. A bibi so obetima inherit. You can inherit na bibi obetima GF maybe umami and now papa ho and now we busu mumu. Also, a lifestyle anywhere and environment can also make you more susceptible and more susceptible and are more likely to be colon cancer. Or lifestyle and it may be one environment. Who is more likely to develop colon cancer? Colon cancer dio obia betimi colon cancer but you will be to say obronibeka like risk factors and bibi wo ho a e betimi ama wo aye more likely to get colon cancer. Number 1, age. The more ubenya, the more ubenya more likely to ubenya colon cancer. Also, number 2, our family history of colon cancer. And that's one case our personal history of colon cancer. Ubetimenya colon cancer. Number 3, your free BB history of adenomas. You do like different tests now. You better for colon cancer. I can talk more about it, but adenoma technically it is a polyp, and as a colonoscopy now. A polyp bibia ye free u colon him. No, it's more likely say no back turning into cancer than other types of polyps. That you to me who will call him. Also, to get colon cancer, no, there's certain who are like genetic history, and there's certain genetic syndromes. It's a bit mama when you're colon cancer, but it could be the Lynch syndrome, and unya ubit me colon cancer. There's also some different types of irritable bowel diseases, ulcerative colitis and Crohn's disease, and also unya for more than 8 years at those diseases. Now you are more likely to have colon cancer. Adia for France more likely to get colon cancer and insanum. I will be on more than 3 drinks every day. Bia no monsano. Sebi obetimenya colon cancer.
But obetimenya repeat e hono kwa ama mesese a.
Me pa chow. Me say wow no monsa de bia every day more than 3 drinks. No, you are more likely to get colon cancer. Increase your risk for colon cancer. Also obi on cigarette de bia na jot one no cigarette and also betima ama wonya colon cancer. And sesia one of the other risk factors no so say uyo tuntum. First, non enema diseases be brain na tuntum for ni enhye first na colon cancer unya American Indian na Asian population no omutenya pan because of our diet no. But say a cheap blacks ne fa yen tuntum for ni nti obi a tuntum is also a risk factor for colon cancer. And now obi nso a woso to say obesity like weight uncheck weight and so beti mama when you colon cancer. And our diet and our didiemu obi wo like we red meat to sell goat and our beef. Nina beti mama I mean you have to do everything in moderation. Yan kase mendio. Me the men kase mendi, but you have to be able to beti me trying it down. Red meat and our fried foods are they be said fried chicken, French fries, foods are they be like your chino with a lot of oil, no bit menya. Also low vitamin D level. They have been studied say vitamin D level it will low I can cause colon cancer. We are your average just sometimes we are into during summertime no so betima kwa bontin uye juma even on your lunch break to betima na bontin for 30 minutes kwa betimenya sunshine and no it helps with your vitamin D. Also low fiber obi wo ha like undi grains is like cereals, legumes nina, and also a lower betimenya colon cancer. And inactivity and a sedentary lifestyle or to baby back unanti unko baby, you know, and also betima cause colon cancer. You have to stay active even if sometimes so far train I'll betima get to one stop before you stop no one nanti. Most importantly during the summertime and maybe weather better. Any diabetes, type 2 diabetes is also a risk factor for colon cancer. Into women na ye niema say we are na say one who ubetimenya colon cancer.
Yo, Sister Anna, so udio mu kakra na menchia ebusiafo a abaso. Sister Ivy Blue wabaso, Mr. John Oten also also a oshaye and Sister Eria Vicky NP also and me amade nyina Mr. Patrick ano also also a oshaye. Ebusiafo me pamocho mon share program na mayen na me kai mo se dagawa awajumedie no so na manu masugusu a mutie yen ene ye ne yen Sister Anna ene betwetwe nkomo o sha ase nche ye but obobo nsem bebre so ye besre o se yente red meat so na afi ensa no eno so yente so nti mema no we de ene de ye ba mu ba o enya se ye de mu besi ha se ye be horo mu de but ye nyina ye ma no bi so every red meat esan no monsa nti no ye nyina in a balanced way said the bear ye nyina betimi enyi ache nti abusia for sa afi na waba so a mpacho bo love no so na share program no e ma yen dwumadi e betimi a share yen e wo Edinkra platforms ni nyina so you streaming live on Facebook, YouTube and yen Digibox ne so ukoso a ni nyina e wo hono sister Anna. Now, who can be about age? Did me funny says I feel na my me 40s and I say me like mirror me 40s, mid 40s to 50s no more. Me call for me regular checkup. A honor makes my request. They say me screening and that's automatically no doctor no show me age no I can say me go screening for colon cancer. And I know a ma any man and mu wine I say screening for colon cancer.
Okay, that's a good question. It depended. You will be United States Preventive Task Force. Oma year, Rabi say from the age of 45 to the age of 75. No, that's when you can begin to screen for colon cancer. Into where the 45 to about 75. Oko hospital or doctor best starting wakasa to do screening for colon cancer. But it also depends on your family history. Obi wo hwa na ebusu emu nyina obi a wo colon cancer. So at that time no, even at age 18 and I say age 20, you can still begin screening. I've seen colon cancer in an 18-year-old. I've seen a colon cancer in a 20-year-old. I've seen colon cancer in a 30-year-old. So it depending on the family background. So one risk factors are to say family history and any man me boss before now me ubetima train 45 to 75 no but say unim say oh me papa wu colon cancer me na wu colon cancer me uncle be so with colon cancer any empacho men train kra okwa no doctor nka so ubetima begin screening early as even in your 20s that you can come back every 5 years or every 10 years depending on what they find with the colonoscopy and through your screening tests.
Okay, abusia for toda and say your change sa age no you say e wo abusia mu a na wasimu ntem prevention is better than cure. Into no say o feel say or family history of any kind of cancer na wasimu ntem na we screening na eja you hu ntem a na etimi aso ano ntem ama say de be ya obetimi enyi ache ana say obetimi atena se ache e de aboa abusia ne adofo Pacho so abaso a na wa share Mr. Frank Sapon wa abaso a wo share yen ana me boss DJ Jam also wo so a wo share MCOG me chawo baby biara a wo bia nti ebusuafo sa afi na wa abaso a yen sister ana na etwetwe nkomo efa colon cancer ho waka bebre na ansa ye be sorry no ye be bone tofa afi nso be phone lines na tumu nti no so obi wasem bisa wo betimi afre na wa bisa wo question na me bisa wo se wa pomoden ho nsem etisen na watwe bia ya to ye ho asi ho se no ma betwetwa pomoden ho nkomo ye kan ebia na deko na de ya to wa ha nyina na aboa wo ekwan bi so eno nti na Ghanaian Healthcare Workers Association ye twa na short segawa ya to ye ho asi ho se na watwe bia ye ne mo ba betwetwe ya pomoden ho nkomo na watwe bia wo topic e de mamo nti no se u follow program na ubehu de eko ebia na this program in favor but the next program no e be favor into the program we say enye health talk nko na ye etoda nso a ye the family matters ebeba ya boa ye ho ese ye ne mba betwetwa pomuden ho enkomo but ene de ye topic no so na ye gina colon cancer e ho asem na ye sister cheche ye mu nti pam che so wo commenter fato ase ho no mo na ye read comment in fama na se wo asem bisa na ye bie phone lines no e de tumu a utimi ebisa na ye yi wano me pa cho sister Anna obobo ensem bebre so ye fa ye didie mu ye exercise ye ne ade mfa ne so obi ho no a ontim like ontimi nante na wakwa bonten na sunshine vitamin D natural one wenya otimi fa vitamin D supplement in the replace sunshine na.
Yeah, of course. Ubetimafa, we always you get the natural source for your vitamins and now whatever lack your body, your natural ones. But medications can always help. Into ubetimafa vitamin D supplements, the doctor betima prescribe you and say be crumple over the counter ubetimafa.
Okay. But on a dear ben science and as symptoms ben na ubeti me identify say be we your colon cancer maybe and say when your colon cancer maybe.
Okay, that's interesting. Actually on my next topic into me, Bible was submit.
Okay.
I say, what are the symptoms of colorectal cancer? And I said, they are okay. What are the signs? Colorectal cancer, and it doesn't always cause. Sometimes who signs be to say maybe I'm also maybe in fine, but it can happen to anybody. But these are what we look for. The very first thing is any change in bowel habits, and I say like you kind of say any change in. Make sure how I kind of like oh yeah more near man. I say like how our own. Nene, like how our yemu behavior. To say we are not like they be out toilet fine. Not all of a sudden unya diarrhea. They be out kwana yens you. To answer for multiple times that is concerning. Also constipation like ne ubi for so many times and also you're concerning. And I say sometimes excuse me, like it's feel it is like you but like still we feel it like we bisa like sabi wako down na say but still you have a feeling say it was incomplete. And sometimes also changing your stool to say only normal, but then all of a sudden when we say like being a kitty and I say ba ne jaya ba muachi bisa, and also could be a sign. Also blood, like any form of blood will be more continuous, especially a bright red bladder. It could be also concerning. Not saying it's a dark blood is so you're concerning, but especially if, like moja will be more. You have to go and get it investigated. And also gas pains, and I say feel it said be and I say when you're cramps, and I say feel like you're fine, yes, and also it could be a cause. Not just one, but you have to have a combination of one or two. But Nina, you can also always check it out. And the most one I may pay attention that in the medical community, your friend like red flag. Any unexpected weight loss. Weight loss, be losing weight, you know. But you have to look at how I will lose weight, you know. To say within a month or two, on your exercise and yes, or your diet. Now, if you will lose 10 or 20 pounds, it should be concerning. It should be a red flag. Yeah, kind of red flag. It should be very concerning. And also you have to really pay attention to it. And also fatigue, and as bread, be our bread be open to me froze steps, and also will be is concerning. So until you have to go to a doctor now on your labs and as on show, no, try to figure out what's going on with you. So these are the signs and symptoms of colorectal cancer, and our signs and symptoms of colorectal cancer.
Partial treatment to be a hormone, and I say it's just medication. I say to me, treatment to be any as a Ghana for the first year I better reach out a baby drew. You know, yet me and me no bomu and I say we are back.
I may advocate for BB because cancer and BB na sabi be solve. You have to. There are different ways and means that you're caught to tackle the cancer, and I'll talk about it. Be a surgery. Track cancer ne free ho. It been so chemotherapy. Chemotherapy normal would draw through IV, not like it could like any type of cancer in your body. Radio frequency, and I say radiotherapy, and also a targeted specifically in cancer cells. So there are different ways for us to go in and tackle the cancer and also try to treat you. And it will depend on history, how old you any old doctor recommendations our doctor them and how long a cancer no any how invasive you can't invasive like how a cancer no akomu and I say didiumu ache. Until we have different ways to cure you if you do have colon cancer.
Okay, it was your form. Mema yen sister Ajina home na metwa me ho age aboafo nkrato abasesia na yatoa dwumadie ne so. Dwumadie se afi no abaso aboafo asoya sene City Medical ewo 2490 Grand Concourse. Say your physicals na ope and I say immigration physicals physical bi a wope anase ayaregie bi a wope se wuji bia ukọ city medical la ombehwe wo first so woni insurance kwa na city medical ebebo amawanya insurance afi our cares organic skin mixture our cares say fa wo hawo nyina bedan no say skin rashes na wo dark spot anase wo knuckles aye tuntum ebi no asere nku bi na ma won sa chi nyina popate say kokwa ya toto no something which is there. Our case say obebo eyisa how ni nyina afi ho no ama say wo dry skin, oily skin and say wo acne. For our case e 917-836-3155 na kwajo de. E mema no so me kanfu oji shades e de amamo. Oji shades nso e be ma wo skin no atoso kama. Afi so Myla Homes say wo pe baby ni abusua atena na mo adwojo mo ho a mo frɛ wo mo na omo be ma mo baby aswe eye Airbnb a omo East Legon amenities bi a wo pe bi say internet access say security access and I say pool and our pair bibia upebia no Myla Homes say uni how for omo ewo +233 530-360-462 +233 530-360-462 from Myla Homes okwa audio ufre o makacha m say din crafo oje number no wedding craft for ho we discount no de untimi enso a afi se wo ha na pese wo bie accounts a for Ecobank Ghana Limited Ecobank for say city account say dollar accounts na pese wo bia na say so pese o japade na say wo pe loan na Ecobank Ghana Limited say bra omo akache na omo beboa wo for Ecobank ewo +233-260-714-3006 Ecobank Ghana Limited so omo hwe wanim mo ma na mo ne medi ensa wo so ebusa for na me kai obi em say the gawa awajumedie ne so na wasugu so a wutie ene ye ne yen sister Anna ene twetwen komo efa colon cancer ho yen sister family nurse practitioner ewo New York Columbia campus ena oni ya twetwen komo yi ti say wo question bia na mpacho fa to comment section no na ye afei na yen read ma na answer anasa no years say sister de ma no no de ama e kakra so be phone lines na tum so bi person friend na obisa asem a eno so ekwan e da ho no ma betimi ebie na obetimi afre na wabisa wasem na me ka obi em say the gawa hour dwumadie ne so na wasugu so no we didn't it na sapon the host of the gawa hour sister Anna inti ya fa say treatment no say ebia me fa ne say obi enya colon cancer de bi na so aye surgery how possible say ebetimi asan aba anaso nya surgery na udadwe nyina to atwa
most times no be a surgery now it doesn't back but there have been cases that maybe within the next 10 or 20 years so be na e wo hostel but doctors know I think some bomb home modern my therapies and therapies and my therapies and surgeries on be ya mouth send colon cancer and back but there's always means 100% that nothing can ever come back. It's a possibility, but the chance of it coming back now is very low after surgery.
And it was for your sister Akosia M Owusu Ewoso or say good job says and as your sister Akosia Eninuwa or say this eating too much let me say well you need the question not if it's so and Mr. Michael Oheneba Fianco or say good job says aye momfa mo questions no emrana yen bisa yen sister and no yen ti and no ha no money there be ada make say we insurance now so we call the officer ubetia consultation fee Edin craft for any the gawa hour you said the bibia air bremu free until you guys need to take advantage of this now the edibe bremu biano ebia na call Dr. Kana ebia na question Kana okobisa na refi so no na the wetie no ha no na ebia watimi adwo to bibi de ato ho no ma okwa obetimi e de kobisa o doctor yen sister Deborah ni makon also a o share Mr. Frank Sapon also a o share na me ma yen brother Mr. Frederick Addison, a happy birthday. And Obi Biara and your birthday. Mr. Lawrence Otibu, happy belated birthday. And your birthday. Mama birthday, Eddie and Nimwa Eban so happy birthday in advance. Inti eneno, yes say, calling cancer hon ensem and ayeka. Yes, red meat no, yenteso, and sano, yenteso. Upe se unyi cha. Wona obebo wapomuden ho eban said the beya ubenyi ache nti no se doctor kira wo se ebia ti we so wudi so a wa na wo to won kwanem ba se we ni so a na wa na etin prepi me ka say doctor too for na wa ntia ebedru mre bi no ebia pains a wo be kom no doctor no nko bi mu ma wo de dru ho no na ma painkiller anasa no ma we painkillers anasa edro na ye de ma wono so yeah, ma de ekele wo pain no na eduro no so esan atwe yare foforo e de ma nti esra mu a ma ye ni emra ne so kakra se de be ya ebenyi ache obi bo ne nyom wi ase e de this holidays ya chili bia ma ye ho akama se woni ahoden a untimi nchele me weekend bia me ni adaje ye namo chele ni nyina so na ye boy ye ho ban se de be ya ye benyi ache na ye ma na ye de omo aba no so yetimi ne omo atena asasi so ache. Intino say, oh, a questioner. Me pacho MCOG or say what type, how many types of cancers do we have? Men and women who are more prone to having cancer or rectal cancer, colon cancer or rectal cancer.
Question and pacho bisabium.
Okay. MCOG say how many types of cancer do we have? And men and women who are more prone to having colon or rectal cancer.
How many type of cancer do we have, like in general or in the colon? So colon cancer, there one type is just in the colon or in the rectum, but it depends on what part of the colon. A bit may see sigmoid and a descending and a ascending. It all depends on the part of the colon, but it is a colon cancer. And a rectum, no, and no dear. A rectum and I said be otua no and also otua and no ye friend a rectal cancer. In terms of the second part of the question, Barney Bema, who is likely? From what I've seen, a lot of men get a lot of colon cancer, colorectal cancer, and unfortunately, no, so in terms of colon cancer, in Bema more, rectal cancer, and so in Bema more, and I've seen just to be correct, I've seen lots of rectal cancer in like the gay population as well. Okay. I'm not we are not targeting them, but I'm just trying to get the information out there that I've seen a lot of rectal cancer in them, and I've also seen a lot of rectal cancer in people who don't have that type of lifestyle, in both men and women. But to answer his question, colorectal cancer is more in men than women, but you can find it in both of these genders. Yeah.
Okay. Or say what question be
no problem.
What age is likely to have? Or say what age is likely to have it?
What age is likely to have it? I'm not probably between 50 and 60. Between 50 and 60. Okay. Because guidelines now from 45 to 75. Usually you don't see it in the older population. No? And the older population, no, sometimes in their 70s and 80s, they tend not to do anything about it because some of age then may happen because of course going through surgery and chemotherapy and radiation, it takes a lot out of you. So some choose not to do anything, but average I've seen it in 50s and 60s, 50s and 60s averagely.
My patroya sister Akosia and Iniwa said, does eating too much ice good for the colon, and if not, what can it cause?
Eating too much ice. I don't think so. It's either way. It's just like drinking ice water. But the American can say ubeti too much of everything is bad. Ubeti but most importantly, ensure at room temperature is much better for you and your colon than ice water. We share Chinese for na Asian population na meaning nurses near near jumana na even hospital setting na omo num cold water omo tie num in like room temperature because they feel like it's like the temperature of your body. Room temperature water is always better than ice ice water as long as we get excessive and I say over ice. Over ice is some patchoya. My doctor and check you could be a sign of anemia patcho into my doctor and check us over ice pass idea any my check on patcho. Thanks for the question.
MCOG say, are kids capable of getting colon or rectum cancer? If yes, what actually causes it among the cases? They don't drink, eat more red meat. Drink and eat more red meat.
The youngest I mean who colon cancer 18 between 18 and 20 mean who below that. But is it possible? Is probably possible, but it maybe a better genetic factors now. Yeah, can be no, because like question the kind and so the red meat and so or smoky cigarette and also or no monster. But genes are there mojemu and everything is possible. So it could be possible. So be under 18 can technically have colon cancer, because even scopes now you're using in your pediatric scopes, so I'm sure they find some, but maybe population in your pediatrics. I usually work with adults, but I'm sure that they have found colon cancer in kids.
Mr. Patrick, I know Ebisa said, what age is appropriate to get tested?
What age? Oh, United States no, task force no, for us medical professionals on my guidelines, and the guideline says from age 45 to 75, right? But meneo can before, it depends on our history. When them say we busu from colon cancer now, so papilla colon cancer or uncle or grandma, and yet doctors no can start screening you earlier than 45, no, even 18 and I say 20 crowd bit mako. And now more family history, no, they want them to come back more often. Uyo colonoscopy no me who be umua in terms of polyps and I be able to cause cancer about 10 years. But our family history no me who be umua instead of 10 years no more than 5 years, because our history no, and you are more likely to get cancer. So it all depends on your doctor and then all risk factors and all background.
Yo, ebusa for me papa chow share program no my na mombo love no so my Mr. Kwaten Amwako or say thank you for your good works. God bless you. God bless you too, bro.
God bless you.
And we saying so Jenny Kwaku or say well done, Anna. This is Jennifer. Okay, so okay. All right. Thank you guys for the morale. Or say this is Jennifer Fianco. Colon cancer is rampant among black men. Lifestyle modification is important as well as checkups too. Thank you so much for your contribution. I feel so me Uncle Ben Wabaso. Uncle Bako the whole world. Uncle Ben, dear, with your friend now about now the upebia Uncle Ben say otara which Benji Kumasa. Yadamasi be busa for mon share program no and famaye. So opesa ofre ebisa questions so obetimi afre yengo 443-813-7549. Mbajo me pini number no ede mbebo number no ede ato ha no obetimi afre what's obetimi afre direct and also obetimi afre WhatsApp into no number no 443 813-7549. Pamacho mobetimi afre number na me de ato ase na wo asem bisa bia na utimi ebisa utimi frɛ direct and also utimi frɛ yen ewo WhatsApp ntim pamacho mon share na mon bo love no so emaye abusuafo sa afi na maba so a the gawa awajumedie no so na wasungu so utie no yen sister Anna na etwetwe nkomo efa colon cancer ho wa cheche yen bebre mo so mo de mwadwen che bebre so aba ntino pacho Mr. Me Uncle Ben or say what are general good lifestyle habits one must engage in to reduce your chances of getting colon cancer?
Okay, thank you for that question. Ubetimi aye enyema bebre betimi a decrease your chances of being colon cancer. Not smoking, men smoking, men drinking, ube drinking so limited or alcohol to less than not more than 3 per day. It will be more than 3 per day. Every single day be try to limit it. Also, managing your weight. Weight will stroke cry at least. Ube started with walks. I know saying it easy, you know, but you can start with a walk, even if it's like 30 minutes every day. Now I 30 minutes. Next time, now I 1 hour, you know. Just bibi kutu be just ent na hofa konde bia sa aunye bibia. Oh sorry, and uko fridge mu no about TV. Nina, it's not good for your health. And also getting regular colonoscopy screening, you know, or regular checkups with your doctor. Screening no la meka, you know, say bibi anima, you have to come back every 10 years into making sure so we every 10 years. Now cons no more polyps no more yifima, maybe on beka se bra between every 3 to 5, depending on the type of polyps or mu ya na so family history. Into please just make sure so follow up. Also regular exercise, you know, just the same thing. And you prevent cancer is the same as preventing any type of diseases, heart attack, you know, heart and stroke as well. You know, watch your diet, eat right, control your weight. And also if you have diabetes, try to keep it, you know, in check. I'm a unya colon cancer. And always, you know, check up and you know, I'm not trying to stereotype, but you know, because black men who colon cancer don't be afraid. So be now doctor check you and they can check, you know, they have different tests on betima check you Cologuard, stool based test and all like budget sample of food like sabi ubi normal check it to make sure say like the cancer genes are not in there. Besides that, to bet my flex again, every 5 years. Into your whatever your needs are, and we have different types of tests that bit me a tailor to suit you, and I say you bit me a tailor to screen you. Say na unya colon cancer and intimate pouch. Mama say mo be hospital and mo be check it with the doctor. No mama nenye bibia mo ye. Even though maybe nobody really wants to go and hear bad news, and I say be doctor debia ho ba pouch. Let's try to do that.
Oh, my patcho MCOG question. I was apart from surgery, is there any other ways of managing it? Would you advise a traditional way of curing it?
I mean, besides lowering risk factor, I wouldn't. Besides lowering of risk factors, not to get it in the first place, it means to me advise it against something that is not, you know, medically recommended, because medically recommendations not mine, it has been there for years, and I have research to back it up to prove say when now a bit me I can't go me and deviate from that and Emma say oh maybe unum way and I say Sebe unum so bula a bit back a bit sorry a bit my cure colon cancer, just you know the minim na is medicine and it's backed by research, and that's what I believe in, evidence-based practice into Pipamocho. Mama yenti that you can, you know, in terms of how we call doctor who be screening BB and I say I can't recommend any other things for that.
Oh, say Ghana no. BB I BB draw back no. Esa yare bebre. Metia say me si benya code e beka se me nkonu ma BB drew. Pompa bomb me beka se me nkonu ma BB drew. Inti na most of the time no automatically no yen dey nim say BB I BB drew. Obisa say how painful is colonoscopy?
Colonoscopy and I don't know if it's uncomfortable and probably painful if you do it without sedation. Before we be colonoscopy, the doctor be who, anesthesiologist be who, and they will put you to sleep. And then like general, your free be general anesthesia because like any the tubes she show mono, and usually maybe on be like propofol, and no, you will be monitored with an anesthesiologist because you know it was so more monitor under that medication, but after the procedure, that medication comes right out of your system. It's you have to do it under some sort of sedation, but at the same time to me because they want to see what's going on. It can be done, but it is uncomfortable. But I believe there's a certain part when they pass certain part of your colon pass it by, like it gets easier, but it's not something that I will advise. I will say that you have to do it with some sort of sedation. Okombema withdrew Normal put you to sleep, normal your movie and you get all your results right there. Polyps are now BB will more bit make you training in from normal the call lab, and then you get the results within like a week or two, and the doctors will tell you whether it's a cancer causing polyp or a polyp that's not cancer causing. One good thing about it, and it's who results in right away. And sometimes so cancer, once we go in, we can if we were how rumor, you can unfortunately you can see right away that it's cancer. And we don't, those type of news, we don't like breaking it, but we have to do what we are doing because we are here to save lives basically. Police be one you cannot tell be one as soon as you go in right away. You look at the mucosa, you can tell it's cancer, but we say that it is cancer potential, but of course we have to, I would say they call lab normal testing, but some of the things that we see now, we know right away say cancer.
But Obi Bisa said after surgery, can you work?
After surgery, can you? I think you can work. It depends on you and what type of life you want. There's a potential, I say maybe after surgery, ebi mubenya colonoscopy, colostomy bag, which is a normal divert to intestines, not outside of our body. So now like ubetimi excrete, sabi ubin. So if you are more comfortable with that and living with that, and also it's you have to look at your lifestyle and what you want out of life. Or being a cancer, they can get the help. I don't think I know much more about the topic in terms of like what cancer, but some people have cancer and they go into remission and they are still able to work, and some people cannot. They have it and it's devastating. So it depends on the type of cancer or any like level I drew, But me that makes my can say good news. They say colon cancer, and it's not like 20 years ago. Now it's like, oh my God, it's like that said. Now saying when you might be bit my hair low, so it bit my including surgery. Sometimes we say encomo too much cry. Even the doctors right away, normal procedures on bit my during endoscopy to cut it away. And then later on they can have like a surgeon look at you to make sure say BBI fine. It's not killing like it used to kill, which is good news, but we still have to have ways and means to prevent it. My statistics be where I say 91% of you surviving. And I say in terms when I say core organs kakra, the 5-year survival rate is 72%. But a call with DMO or lungs, you baby 5-year survival rate is 13%. And to make can't wait to say mama yen koye in screening, and because the earlier we find it, the better we can cure you, and the better your chances are of surviving this cancer.
Yo, I was here for yen sister my auntie say no cancer biya mpo no enye life sentence bi enka na enya boss pe na oyam hyehyew, but say with technologies and studies doctors na aye no omo aye ade ntini wo de ane se obebo ho ban afi biya no akwakoya wo check up obi ohodom a o insurance enso check up no ono a onko obetwe last minute no no na what put the doctors into an impossible situation na akoye 50-50, but ka ya dia otimi ko ntem ye ka se bra na wakono akoye a etoda over time no yente so kakra sika na wo bepe no wo behu ana wontimi enjoy sika no wo behu na diskari nyina esa wo ho yare. Next week me will another important topic ye deba eno over time no se mbeja to ho no kakra mbeja over time no ato ho kakra ye pese ye de edinkra multimedia ene gawa awa ye de boa wo na wunyi che nti na watwe bi e ba bebisa wo se apomudi ho nsem etese so wo question bi ampa che fa to comment section no e ma yen na yen yi anoma ananso a obetimi afre number na me de ato ase no ofra ye be yi wa no jumedi enso ye streaming live on YouTube obetimi enso ahwe on se wo Digibox ni bia obetimi ahwe wo honom live afi so edinkra multimedia platforms ni nyina utimi ehwe wo honom me twa me ho ade aboa phone krato abasese ya ne asan de jumedi no ato aso jumedi omo aso ya sen ye keke KK Ruby Cuisine. KK Ruby say event bi a we bia so wo obi amana anoa enuane amawa frɛ wɔn ɛwɔ 646 530 6126 say ya wache say ya jollof say ya cheke bia de wo pɛ bia enam a yache fried chicken yɛse ma yɛ nwen so ye do party so ko ade a ye kakra obi nko ade ye bɛwe na eja wa frɛ KK Ruby Cuisine na omo anoa onuane na ma so wo pɛ obi amana ye decorations a obi abeka say wow decorations see de no nete so a me kanfo Questi events at the amount from 646 841 6420. Afe say wo pe obi nso amana ye drinks. Yeah, your local drinks, sobolo, ginger drinks and the keka ho ni nyina. Eno ane se obefe Lordan drinks. 347 740 6093. Wo be baby age ayare hye ebia na doctor obekọ no ye beka brofo ne tenten na ye wasom bebre a meka fo city medical e de amount ukọ city medical etwi e no mo ka no honom nti no ane se wo de say immigration form po natural wo say be physical sa ukọ honom a ombe ni nyina bi de amount say annual checkups omo hye nkola bibia ope bia say even physical therapy ene de wato so a omo ni nyina bi e wo honom me can for the medical at the amount when insurance crown bebo amawanya insurance afa say wo ko Ghana na wo pe bia asue wa asumdwe mu a me can for Myla Homes at the amount Myla Homes say long term and I say short term and I say wo pe bia ni abusua any adofo atena eno ane say wo be frɛ wo mo e wo +233 530 360462 Myla Homes say security uni how internet access uni how bibia wo pe bia no they have your back nti frɛ Myla Homes o frɛ ka chan say o je number no e wo edinkra ho discount e yebochu afi Ecobank Ghana Limited almost say right na mo ne omo emedi ensa wo so say loan na wo pe ebusa from some fancha me kakra na this week I'm a little bit under the weather but Masin Kitty said the gawa our jumedi na watchu bia ye de bebrem say loan na mo pe ana say o pe say will be account bia o pe city account dollar account so pe say utua o bills a Ecobank Ghana Limited say frɛ wo e wo +233 26 714 3006 frɛ Ecobank na ne o mo twetwe nkomo na on beboa wo ama wa bie accounts ebusuafo ye ne yen sister Anna Esiama ano na ye twetwe nkomo yen sister nurse practitioner and the colon cancer ho asem na one ye ka nti se wa ba so na wa share na wa like it na wa bo love no so mpacho mo love no so emaye ubetimi so ahye YouTube na menchia ebusuafo kakra ewo so yen sister Jenny Kwaku or see we want more. Yes, we will bring you more. And our sister Doris upon or see great information. Tina and Anna Ayuko, this is important information and information is appreciated. Thank you so much, Auntie Doris. I will say for Nana Boache Wabaso Oshaye. Pope or say colonoscopy saves lives immediately. Do it when you turn 40. You also adventure. MCOG or say when you are going back and what topic should you expect from you? OG, we have a lot of topics. She's actually coming back with a different kind of topic, but then we can do part 2 of this same topic. But she have another topic. Being so, me say topics. This particular topic is gonna be late. Sister, oh, they will checking the schedule no my or checking the schedule now, and I be who dates because I have to work with their schedule. Last week now, as I said, me back Thursdays because we are hard no man on the schedule until me Wednesday. And so my to me who say I will accommodate everybody because Jumedi no who here gawa any edinkra pa se ye beboa na yetimi educate your community no because gone too soon no gone too soon no ya doso e wo your community no e to da said the medical kind obi o insurance card ni se ni bottom won tua eno ane se adwuma mu ye te no a ono a kobo flu pania no koye colon screening ya no eno ane se wotwa bia no adidi no ote ho wotwa bia no adidi ebedu ba bia doctor ntimi nye ho hye no ne da ko shabro bia ote ba bi edwe ne ho yesre mo a gone too soon no ye January 2023 moving forward to 2024 no mo ansha ye beba bebo mopon edincrafo ene gawa awafo ye beba bebo mopon abisa se we screen wakwa akoye wo annual checkups ye ni abre ti esre mo a moma ye ni emra no so se be ya ye benyi ache me si obi bo ne nwon se ewi ase ye de moma ye enjoy ewi ase no safe no abaso a de gawa awajumedie no na wasugusu a utie ye no betimi ahye ye wo YouTube and ase Facebook and ase edinkra multimedia edinkra platforms ni so nyina ye streaming live na wa share program no e de amayen okay sister Anna be pacho or say, what can you do to prevent yourself from getting colon cancer?
What can you do to prevent yourself from getting regular screenings starting at age 45? Unless maybe we have family history of colon cancer now or other things like, bleeding and now bleeding and as diarrhea and now constipation. Sometimes these happen, but it has to be consistent for like a certain amount of days and as weeks. Also, me can't diet. So I didn't too much. I always educate my patients about moderation because me catch will be a why a bad habit for 30 years just to stop like that. I say so we are punching 5 days a week. I'm a pap mo chop mo trust on 3. I'm yet 3 and ma go 2 my 1 me pap mo chop. I always work with my patients, okay? No smoking, I mean, don't smoke. Or drinking, so I make more than 3 drinks per day. We bet me traso, maybe we bet me ako 2, now 1, now for we jai. And the young na in bed, including yame. We thank you. When na managing your weight, diet, exercise, all these are things that will be in my bow. And I also high fiber diet and it like sometimes almost probiotic yogurt and also a healthy regulate your bowel and also betima prevent you from helping you in terms of like some of the ways to prevent colon cancer. Inti when now betima so unye make us say mbema get more than mba blacks, American Indians and Asians. These are risk factors that won't me modify. It's like you can't change so you're black, and then you can't change so you like webusuemu, more cancer. And your baby I want to mean change, but that me can't now bet me change. You bet me change your diet. You bet me change how I'll be exercise. You bet me change how I'll no monsa. You bet me change how I'll smoke. Inti kakran no. Now you're na kakran. Inti one day bedu hona nyanku pandom no wejai.
Sister Anna, me say, well, fans are watching no say hono. Well, shall next week in Kwan, on best I bet you on the wabo. Into it was from Poucha one share program and I end share. You're very sorry, so I say, beside for to comment session, and I said, Freya 443-813-7549. Maybe it's our question. Yeah, trying questions ne Stana. There be a footstool and or the be my what can't be brave. But a thought in person born in our tough and also best summarizing in our idea my na 80 so.
Okay. In summarization, colon cancer in all seriousness na yaria ete kuyempa, especially yen tuntum no. And yehu embema ne embemu, but mostly embemu. Eye bibia ubetima prevent on from so binya. And no ubetima share with didiemu. Ubetima like undi a lot of red meat. Ubetima ko chicken and as a fish. Ubetima a lot of diet with vegetables. Me fear I didn't really grow up with vegetables until morning stew. But I try to incorporate it even with now menkwala like pet vegetables, but ubetimia now the vegetables account, the greener the better. Any grains mean whole wheat cereal bibisa ebetima wow. Alcohol try to limit it and get more than 3 drinks per day every single day. More than 3 drinks, that's really excessive in pamocho. you know, be a bit mind in moderation. We are not here to judge anybody, but we are here to just, you know, educate. Say, you know, too much of everything. No say is bad. Into me patch. You know, mu not a lot of fried things. And yet they be an abakoto McDonald's and abakoto Popeye. So people dip Popeye like 3 or 4 times a week. It's you know, it doesn't make sense. Me patcho you know, you come with one body, more body, because right now no. Colon cancer blacks for nepa and never be brave blacks for, and we didn't used to see it, you know, we didn't used to see it in the past. Inti ya bit my educating no and I educating. Besides diet and exercise and alcohol cessation, so alcohol screening there we have different types of screenings. If you walk around, you don't even have to go to the doctor. Doctor bits my order like Cologuard amount. Now why a test no sabi only now they are ship way we not want to send the amount. Now one mainly you don't even have to go to the doctor if you don't want to. And now colonoscopy wo and it goes through your whole colon. Into BB wo you bit me polyps why you bit me. We have different ways to take them out. And a cancer right away and we can tell you it's cancer. But of course we need a diagnosis. Almost flexing and also every 5 years. So we have tests for every year, every 3 years, every 5 years, every 10 years. You will wait now show. I am on check besides diet exercise no and I'm do 45 I'm young check unless so if you have family history of colon cancer and also other symptoms to say maybe they be a benena muja first na me being you okay but see me hwe me ne nso and they be am toilet so I just say me chimsta samanyim you know not no asamane be no manyim inti me pamocho mama young check we na. So my advice we na me dem mama and also another encouragement is said that me catch your sister Tina no colon cancer and yet like a death sentence like before. Of course, nobody wants to hear the diagnosis of say when you're cancer. But the good thing is that doctors know my banner. I can attest that they are very good. Some can even take out cancer right there and then during a typical colonoscopy. Into this ways and means that make surgery, chemotherapy, you know, radiation therapy, immunotherapy that can even use your own immune system to fight the cancer. Into me pamo show.
And na yen sister say yen share yen ho so yie na yen boy yen ho so ban new year and na ye be remu aka na kakra bi ye be ye new year's resolution and na me say yesterday mo for screening e ka ho. The vice president of Ghanaian Healthcare Workers Association, Mr. Patrick Asante Adofo also our share vice ye chia wo afi so the general secretary so sister Ivy Blue and so also say very important and detailed medical information. Good job, ladies. We thank you.
Thank you.
Share the program for us. We don't want to lose anybody. We want to stay here for as long as we can. So please, prevention is better than cure. You have the insurance. Take care of your health. You are paying for something you are not using. So please, I'm begging everybody, all of us, let us get our flu shots. You name it. When you go, you're going to get it. I got my flu shot. I got my COVID booster and all that. And I'm still a little bit sick. Minji we munyina crampo nanka ebe worse than this. Nti esre mo a mama yenye yembo yen ho ban Sister Victoria yeboa or say well said. Yeda masi bebre ebusuafo de bia yede na watwe bia yede apomuden ho nsem eba bedan mo. Yese wapomuden ho nsem etesɛn on the gawa our jumedi ne so na watwe bia said me kan ye no eye wukuada na yetaye program no but it depending on yen guest no so time no say anya wukuada ebetimi aye eda foforo but na watwe no mu bia no yede the gawa our jumedi no eba bedom mo amutimi ba so a mo be share mo be share program na mo share invite e da mo asi bebre mungu so na mo share na mo invite yen sister Salome Techibia ewuku kwache ewo so a ohye yen yeda mo ase bebre ansa ye be sori so no meje aboafo nkrato de aba ansa na ya sori so ejubadie na watwe bia na ye se woton bibi na pese ye bo ho de roma wa mpanifo se woton ade na wo mo ho de ra etise wuti esumu na wamuna nti se pese wo bo bibi ho de ra eno ne se wo be frɛ me general manager MCOG anase DJ Jam na wa frɛ wo mo yebo no eda fom bocho ye beba hu de ro ama traffic ye beba wo store no obeka say din crafo afi de minyansa mpo na me de agisika ne bi ti esre mo a won frɛ ye na mo ne entwetwe nkomo ne ma mu ne ma ho de ro ema mo wo frɛ MCOG na wo anya no na wo frɛ DJ Jam na wo anya na utimi e frɛ me nso obetimi asende me message na me de ama wo mo yene mo ebedi ensa wo so nti no ane se obe inbox me wo ti na sapon me messenger mu na ye de me ne omo akasa ye beba oni ma ho daru e de ama wo jumedie omo aso yasen e ma ye de brem na watwe bia e Ecobank Ghana Limited. Ecobank says accounts bia opese ubie bia say ye city accounts, dollar accounts, and I say opese uto ejapade wo Ghana na so pese ye ejapade na ohia loan na free Ecobank Ghana Limited na omobeje wo fel so for Ecobank ewo +233 2671430006 na ene omuni ensa wo so afi se ope baby ajojo ho baby abambo ho nsem tight Wi-Fi and everything that you need. Ti said the oti krom he ya me kan for Myla Homes e the amount Myla Homes say Frewamo number ma baby aswe ajojo ho from Myla Homes our +233 530364662 afi so pese we de no etoso na hama ene na me can for our Cares organic skin mixture at the amount. Our Cares say skin problem bia will be a fabedan woman or beboa. Our Cares a ma extra and a man so sra. Say we pair body scrubs and I say we pair gels and na bibi biara we pay biano. Our Cares say was signing name for a bedra so enche bepa hon to my amamu. For our Cares 917-836-3155. 917-836-3155. Sister Anna, chia ebusiafo ene adofo na yen sorry so.
Okay, me that's me chia me ebusiafo ne adofo nyina me mam no papa omo hwe me free Chicago me chia omo wondan fofo so omo hwe me e New York, Chicago and other places me I thank you so much for watching me and I'm da me kunu ase ne memba omo hwe me wo fie ene empire modern bomma me come me down e bibia and I so me sign da wutin ase for inviting me na me sign da Adinkra Multimedia #1 in New York, no side. Madam Asi so much for inviting me here and I'm just very grateful and because I get to come here not only to teach but to educate everybody and Nyamin sure be thank you so much. Obi so me very few. It's not me pamocho. I'm just very grateful. Me do be as obi am send a link over share ye be Madam Asi. Thank you so much.
You, Mr. Neil Lynch, also we appreciate your knowledge and guidance so that we can be better prepared to fight these illness conditions. Thank you so much.
Thank you.
Jumedie said the media can no Edinkra Multimedia and the Gawa our Jumedie. Yes, na what tribia yenima between komo near bisam so pomode ho nsem etese. E bia when wash a program yi na when je ho na so pese wo ye guest and na so be free MCOG and I said DJ Jam and I so be jam so message. We jam a message we can work on the time and the scheduling no na waba. Na topic also pese wo be chere no wetimi aba be chere. Ene ebusiafo me so mefa akwanya we so na machia adofo ene ebusiafo ewo so Sister Rita Akosia or say God bless you both. Thank you so much. Ebusiafo ene ahana mrebe ma ye ho kwan ama ye de gawa awajumedie no ebebremo nyame adomo a dasene ye besen ye hia dasene no new year. Inti no na de me sister Anna yenso ne ye wo ma mo ne say new year yi yesre mo ya this ready dey to wanimu say get your screenings. Edu so say esese ukowo flu pane akowo. Enye ye nko a na ye wo mpane no ye ma no so omo wo unim say unwo ya school nurse be frɛ o ma no enwo ya nti ye screening for penifo no na ye screening for nkola no da bia ye say prevention is better than cure. And had I know it's always at last. Ye pamocho so woni insurance kwana kromu ha no sebe onya mobo ubetimi enya ayarehwe nti se wo insurance na mepacho kwaje wa ayarehwe se woni insurance nso a ko ebi ahonom a ukọ city your friend say crampo dey say utu ani ba bia utimi bo raba bia say mepamocho mo hwe me ye be hwe ti esrem a ye desrede a the gawa hour any edinkram what media ye dey to monim ye say go get your annual checkups. Me say obi nwom say ewi ase e de mama ye ntena hanom na ye ntimi ye ma no ye mpese beja wo mo honom gone too soon like I said no ye too much ama ye na me de akwanya we say so ma Mr. Frederick Addison ene your birthday wow birthday ediso ye ma happy birthday in advance and I'm also a birthday etwamu ye ma happy belated birthday ti nyame ya adom adasene ye de ye ne mu behia ewo the gawa hour jumedie ne so muso mfuti na saponi makramo ye ma mo official po happy new year.